Having been trained really in the late 80s, we've seen this tremendous evolution of hair restoration procedures. And with my training, we were doing pretty much everything with scalp reductions and flap surgery and various grafting techniques. You know, since the introduction of the follicular unit concept of grafting, and that's something that I have taken on as being the primary means of hair restoration in this day and age. So the end result basically is going to be based on supply and demand, and obviously individuals who have more extensive hair loss have fewer hairs to donate, but they need more hair to get density. So really the nuts and bolts of it, the way I look at it, is I'm trying to achieve two goals for myself and for the patient. One is naturalness, one is density. Naturalness is pretty much guaranteed because we can create very natural looking hair based on the technique of how we put the graft distribution, how we angle the grafts, using the follicular unit concept. Density is going to be the final thing that limits the result, and that's based on what a patient has. And you know, I have to be able to meet the patient's expectations for density, and that really comes about from evaluating the supply and demand factors on that particular patient's head. And if we can meet their expectations for density, whether it's a full head of very thin hair or isolated areas of thick hair, or full head of thick hair if they have a limited hair loss, then we proceed ahead and hopefully they'll be very content with the end result.